Wow, I had a great chat today with Robin Roscigno of AuTEACH. We talked today about autism in girls. This is a topic that is not addressed enough. And today we really break down characteristics of autism in girls. Robin does an amazing job of giving us guidance as providers and also really talks specifically to parents. Parents, if you are suspecting that your child has autism and they are female, Robin has some really great information to share with us. Robin is the creator of AuTEACH. I got to know about Robin over on TikTok. She does an amazing job of disseminating information over there. And as of our taping, she has 100,000 followers on that platform. And she's really reaching a lot of people with her message. She was a special education teacher. She is now no longer in the classroom currently because she's working on her PhD. She is autistic, and her daughter is also autistic as well. So she shares with us that journey, and she is an expert in this area. And she really shares with us such important and functional information, whether you're listening as a parent or a professional. Robin's mission at AuTEACH is to make information accessible and to create a community of like-minded parents and teachers who imagine a different world for their children and students. She wants everyone to have access to information that will help them live in alignment with their values as parents and educators, and for autistic children to grow up in a world that values their unique strengths and contributions. So if you're listening and you're a parent, or if you're listening and you're a professional and you want to learn more about autism and girls, what that may look like, maybe why girls are not being diagnosed as readily, this is such a great episode, an important episode, and Robin just shares such awesome information with us. Let's get into it.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABA Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
Thanks so much for joining us on episode, I can't even believe it, 51, people. That's a lot of episodes. And we have such a super special episode today, one I'm really excited about. We have with us Robin Roscigno. I hope I said that correctly. I practiced.
You got it.
Okay. My maiden name is Donatelli, and I miss that. Rosemary Rosella Donatelli. That's my full name. I do miss that name, but I'm so excited. Thanks so much for joining us, Robin. It's so nice to have you on.
Yeah, thank you so much for having me. I've been looking forward to this. It'll be fun.
Yes. And so Robin, I just got acquainted with Robin. I talk about social media quite a bit here because that's a way that I like to share information. And Robin has a stellar TikTok where she shares a lot of really great information that I would say is thought-provoking for parents and professionals. And so AuTEACH, is that correct? Is that your name over there?
Yeah. Like, I wanted it to sound like outreach,
yeah,
but like be like a play on words, but people just say AuTEACH.
Okay. I never know, right? I'm always saying things. That's good to know.
All good. Yeah.
But she has an amazing TikTok presence and really shares a lot of thought-provoking information. So I appreciate that. So we've kind of gotten to know each other, I guess, over the past couple months as I try to make videos. And I did have one video, though. I started talking about IEPs, and I think I have one video that almost has been viewed 200,000 times, which
that's awesome. The first time that happens is like awesome and also scary.
Yes, I know. You're like, oh my gosh, this has been shared. Who's sharing this? Why?
Like you're like, shared? Why did 4,000 people share this video?
Yes. Does my superintendent have this? Yeah. There's a lot of thoughts, but it was fun. I enjoy that. It is exciting and reinforcing. But can you tell people that may not be familiar with you and your work? Can you tell us a little bit about you, your journey into what you're doing now, the autism world, and all that good stuff?
Sure. So it's a long story. I'll try and make it short. But my brother was diagnosed when I was a kid. And so we were, very active in like autism stuff in the 90s, my family, specifically, floor time, Greenspan.
Oh, okay.
My mom was a follower of Greenspan.
Oh, okay.
So I grew up in like that kind of environment. And then I went into teaching, and I taught primarily students with autism. So I taught in New York City, District 75, self-contained special education for 3 years. I taught for 3 more years in New Jersey. And while that was going on, my daughter was diagnosed. And then shortly thereafter, I was diagnosed. Because after, sitting through so many meetings, being like, I do that. I do that too. Right. My daughter is basically a clone of myself. So if she is, then I am. So I was diagnosed then as an adult. So I was 32 and my daughter was almost 3. So I went through all of that. And then I left teaching to pursue my PhD. So my PhD specifically, I really wanted to look at the way that we educate autistic students, because I had seen, some things. And I just had questions like, how did it get here? Right? How did we get to this place where what I was seeing, I would not consider, trauma informed or sensitive, or really affirming in any way. And so I had just questions about how that came to be. So I left to do my PhD in 2016. And I'm finishing up now. So I'm ABD, I'm working on my dissertation. And so, so that's kind of how I entered the autism world. But while that's been going on, I've been, working, doing independent educational evaluations, doing some consulting. And so I've been, involved in that way for, a long time. So that's kind of the long and short answer.
Okay. I didn't know that you were a teacher. So that's good. I mean, I like to have that. My background was I have always worked in a public school. And then the reason that I got into really specializing in autism and helping autistic individuals is I worked in some private placements for students. But I think that having that school perspective is so helpful because I do a lot of consulting too. But I think it's really good to understand, like, what does the clinic look like? What does school-based look like? Because those models are so very different.
So different. And like parents sometimes will come to me and be like, the school says this, I know they're lying. And I'll be like, they're probably not lying about that. Like that actually is like a real thing. Like they probably actually can't do that. Right. Or sometimes I'm like, yeah, it does sound like something's a little shady.
That's nice. So you do some consulting for parents and things like that? Okay.
Primarily that's, I do a lot of consulting with parents specifically, some educators, and sometimes I'm hired like by districts to do educational evaluations, but primarily hired by parents usually.
Oh, that's great. I love that because you just have such a holistic perspective of having your brother having autism, yourself, diagnosed, your daughter, but then you were also a special education teacher. It's this really great experience that you can offer people, from all different perspectives. I think
to try and like balance it a little bit because it kind of gets, especially among like the autistic community, there's a lot of like polarizing. So I kind of try and translate a little between the groups a little.
Right. Yeah, that's what I've always tried to do too. Like I'm a speech therapist and a BCBA. So I try to build a bridge because a lot of BCBAs and SLPs do not get along at all.
That is true.
And there's less than 450 people that are both. So I have always like kind of why I started my business, hence ABA speech, was to like kind of build that bridge. So you're doing that like with a different people, but I love that. That's great. Okay, so we talked a little bit about your journey into the autism world. And today what I really wanted to talk about, a lot of your content is centers around, sometimes you share with your daughter, like I really loved that video. I think it was last week where I think you were showing different ways that you could work on colors. And so I loved that because, I know you don't agree with ABA and things like that, but, I try to have a really play-based approach to how I do things. And I loved this video. It was a video that she showed, like, this is ways that you could work on colors. It could be something fun. And I think you had different colored bowls and maybe different colored objects. And you were showing how you could work on it that way, which appears to be like more play-based versus, having flashcards and doing more of a discrete trial instruction. That's what it seemed like to me. And I think those things are really good to point out because every kid could benefit from that. I always say keep things fun and functional. So, for some students, working on colors is functional. And I love the way that you showed that because I think sometimes people don't really self-monitor how they are providing instruction. So I think your videos really point out, like, we don't have to have groupthink. We can
we could just do it different. You could come up with your own activity that's fun. Yes. And It's funny because I had a lot of, behaviorists and stuff in the comments as per
Mhm.
usual.
Right.
But saying, well, some learners need to do it in the less abstract way, in the way of the flashcards, that it's
Right.
simpler. And I was like thinking, I was like, that doesn't seem simpler to me, but maybe this is like where me being autistic just makes me think about it
Right.
a little bit differently. Cause I was
Yeah.
like, it's actually more abstract to abstract color from things because we only ever talk about colored things, right? So to
Right.
abstract color as like an abstract concept independent of it being an attribute of other things, right,
Right.
is actually more abstract.
Right.
It's not less, right? We don't ever, and also you're holding an object, it's just a piece of paper.
Yeah.
So like autistic people being literal, like this is still an object. It's just a piece of paper. It's a different object, but we're supposed to
Right.
like forget it's an object somehow.
Yeah.
So I was like trying to explain that, but I was like, I don't know if this is just a thing where me being, autistic is like, this actually doesn't make a lot of sense, really.
Yeah, no, I loved that video because I do try to like talk about how I use play-based therapy, and I do that more so on Instagram because I feel like kind of on TikTok, I feel like it's more things that are more thought-provoking, or I don't want
Yeah.
to say negative, but people want to chime in. I feel like that's kind of where I get all my views on TikTok. Where on Instagram, I can be like, this is how I worked on this today. And people really
Hmm.
appreciate that kind of peek into my therapy room. So I really like that. And I think it's good to like show those different things. But, with you being a female, with your daughter being a female, I did want to talk today about autism in girls. Last
Yeah.
year, before we press record, I was telling you we did a webinar with a fellow speech therapist who's actually very strong and big into the neurodiversity movement. She talked all about, she doesn't have autism, but she talked autism in girls. And it was really, really well received. And we haven't talked about that on the podcast. And I thought, hey, you'd be good for that. And I think, good to talk about. But, I used to say when I first started in the field, which was almost 20 years ago, I would do presentations and I would say, the prevalence rate of autism is 1 in 200 and something. And, it's 4 to 1 boys. I would always say that, right?
Hmm.
Because that's what the CDC says. And then, like I'm constantly learning and things like that. And that still actually did go to the CDC website. And
They
it
still
does
say it,
still
yeah.
say that ASD is 4 times more common among boys than among girls. And, now that I've been doing this 20 years, I obviously work with females and have worked with many, but, and I don't say those things anymore, right? Like I don't say it's more common in boys than girls, like, because I feel like there's all these things that, why are we still saying that? Because I feel like it's getting, missed. And so I'm wondering why do you think it is getting missed in girls?
So a couple of different things. One, there is this kind of discourse that autism is just different in girls. And I kind of want to debunk that as well. It is not a different condition, right? It just presents differently because we are socialized differently.
Mm-hmm.
Women as girls, and this is true even of people who are assigned female at birth and then later transition to another gender, right? Still experience some of these same things and are still underdiagnosed
Mm-hmm.
because of socialization, right? So as if you're socialized as a girl, right, you are socialized to put others' needs before yourself, right? To internalize,
Mm-hmm.
just kind of shrink to yourself, right? As opposed to externalizing your behavior. It's far less acceptable for a girl to have kind of externalizing, emotional outbursts or behavioral outbursts than it is for a boy, right? So we tend to see a lot more of those traits becoming kind of internal experiences versus these externalized behaviors. And since most of the research really studies boys,
Yeah.
right, we see that time and time again, the research prepares people very well to identify things that they can observe, right? But not necessarily to identify things that people are experiencing.
Mm-hmm.
And if you're experiencing something in a way that is not visible, or maybe is more subtly visible, then it's going to be hard to identify those particular traits. So if I'm ruminating over something in my mind over and over and over again and saying the same thing in my mind over and over and over again, you may not know that, but that is very much a restricted and repetitive behavior that I'm having.
Right.
So you wouldn't necessarily see that in an evaluation, but you see it in patterns over time, right? So
Mm-hmm.
you'll see girls that are, routinely will play the same play script over and over and over again. But in an evaluation, they just do it once. So you can't see that it's a pattern. It's not the same as flipping a light switch or, spinning a wheel, which is repetitive in a single instance. It's repetitive more over time. So it really, the way that we diagnose and the way that evaluations work are really skewed towards properly identifying people who were socialized as boys. And so we also have a hard time seeing repetitive behaviors and things that are traditionally female interests. So you may, see a little boy lining up trains and think, oh, well, there you go.
Right.
But little girls who spend hours organizing their Barbie shoes, right? Then we say, oh, how cute. She's such an organized little girl. She's going to be such a good little mommy one day, right? Because it's expected for women to clean and organize and to take care of things, regardless if it is distressing or, something that is taking up so much time in the day and it's not actually a leisurely activity, right? It actually is a kind of perseveration. But we don't see it as such because it plays into these particular like gendered ways of being.
That's interesting. I've never thought about that, but that whole idea of I was just thinking about, what are the ways that you are actually diagnosed with having autism, and all those things are, you do historically think of the kid, like, the child that comes in for the evaluation, he's not yet speaking and he is lining up all the cars. The mom is excited because he's talking, but he's completely just saying stuff from TV shows, but these are the hallmark things that you think of because they're more boy oriented. I mean, I'm just thinking of even some evals that I've done a long time ago. Like what toys do we even have present for the kids? You know what I mean? Like, do we have
and
Barbies
it's very
present?
accepted for girls to be stuck in like princess play, right? So that's like an accepted there's like an accepted level of like fantasy play for girls that like maybe not for boys. So when you see kids that are scripting, right, it looks like they're just playing, right? So I put up a couple videos of Pia twirling around in her princess dress, but she's very obviously stimming and doing a whole script, right? But people were like, she's just playing princess. All little girls play princess. I'm like, well, not like this. Right? Does your little girl, when you have to hide the princess dress because she won't take a bath, does she put it against the ground? Because that's what mine does.
Right.
It's like not the same. But because on the outward, it looks like something that we expect from little girls, then we're not flagging those behaviors as something that is worth even discussing.
Yeah. So maybe it seems like, because that was my next question about some of the characteristics, but maybe those things are more subtle, because I remember we had this really cool conference here in Ohio. Now it's virtual, it's called Milestones, but there was a lady, and I'm on like the committee, because I present a lot, but there was a lady that was, about your age, and she was not diagnosed with autism until she was much later. But it really caused her a lot of stress in her life to not be diagnosed until then. And she really was just, kind of angry about the fact that she wasn't diagnosed until later in life. And, like these things were probably just missed, especially for us, like I'm 42, this lady was like a little bit younger than me, but I can see, if we weren't really kind of analyzing and really kind of honing in, plus if you're in a school-based situation and maybe you're doing fine in your classes, right? And some of these things might be very minor, but a lot of it might be more inside. Like I had Dr. Kerry Magro on recently, and he said, and we don't use the terms, I always talk on my Instagram, when you say high functioning, low functioning, but he said people might call him high functioning because he has his PhD, he's been on TEDx, professional speaker, a lot of these same things that you have. But he said, my sensory needs are totally, I'm high support there. You know what I mean? But those are things that me having a conversation with him on the podcast, I would never know that. And people would never know those things. So that it goes a lot deeper. And I think we don't really analyze those private events. It is really what it is, right? When we're diagnosing autism.
Yeah. And we don't see them, it's hard to see them because they're internal, right? So if you're, you may not see that, I can't stop thinking about someone says a mean thing to me on TikTok and I'm ruined for 4 days because I literally cannot think about anything else. And I bring it up in conversations I shouldn't bring it up in. I'm at school drop off being can you believe what this person, and this mom is I don't even know you. What are you talking about? But I get stuck on it to the point where I can't move on from it. And it's really hard. I have a very good friend, I'm sure on TikTok, Kim, the IEP strategist.
Oh,
the other day She texted me and she was like, girl, you got to get off that hamster wheel. Like, just stop. Like,
right.
She's like, you are like, just no more videos today. Like, put the phone down.
Right.
And I was like, okay. She's like, listen, I love you, but like, you got to stop.
Hey, that's nice to have friends like that. You need that, right?
She's
That's
like, you're just
support.
being super autistic right now and you just get off the internet. Like, okay, Kim, thank you.
Take the phone away. Yeah. No,
Yeah,
I
but
like
because
that.
I was someone had made me mad and I was
Right.
like in that like
Yeah.
hyper fixated, like I'll show them.
Right.
And I just like couldn't stop.
Yeah, yeah. Yeah, but that's good to point out because I think sometimes it's just, especially from the behavioral world, they just, we talk about behavior, it's observable, but I think that's the thing too, like, with some of the ideas of like people talking about masking and like that whole thing, which could be like a whole nother podcast episode. And we've talked about a little bit here on the podcast, but, this idea of that there's so much going on, it's kind of like an iceberg, right? Especially for people who are autistic, who are conversational, things like that there's really so much more going on that we really need as professionals to be cognizant, of those things. So that's
there
good
is
to point out.
research like looking at experiences of autistic people. This is a probably separate, tangential conversation, but I think part of the problem is that certain fields are siloed into reading only kind of like empiric,
Right.
scientific ways of studying autism, which obviously when you turn studying of human beings into this kind of hard science, you're not going to understand, your experience is not actually part of the study, right?
Right.
It is what is observable. You used to do this 15 times a day. Now you do it 2 times a day or whatever.
Right.
So, but there is research, qualitative research, historical research, right, that is looking at these things. So we really just need to have more interdisciplinary conversations about research around autism and also know each other's field. Like I'm constantly shocked, like how many people don't know that critical autism studies is in fact its own field, right?
Yeah.
And there are like people within it that do critical work about autism, about experiences, about history. But yet many people who consider themselves autism professionals don't even know that that's a thing.
Yeah,
So
I think everybody kind of gets in their own little pod and it's not always very friendly. But yes, no, I know what you're saying. Yeah, I know. Because I had, actually, I don't know if you know her. You guys would probably get along. Her name's Dr. Megan Miller. She's actually from Ohio. She is a PhD. She is a BCBA. She has a podcast too, but I had her on and we were talking about the Early Start Denver model, which I don't know what your thoughts are on that. But, in my mind, it is more behaviorally oriented but it is play-based and in my opinion, and I do like it. And, I have the book at home and kind of use some of the strategies. And Dr. Megan Miller is kind of an expert in that. And she was talking about it. And she was talking about talking about that with some BCBAs, but because that curriculum was not created by a BCBA, they were not really receptive to the information. So I get what you're saying, but I understand. I know your thoughts on that. So do you have any guidance for providers on how they can support autistic girls? Like, do you have anything that would be more specific to, if we are working with girls who are on the spectrum, anything for us to be kind of thinking about?
Yeah, I mean, I think a lot of the girls that I work with, especially, have the kind of double bind of, feeling a lot of pressure to fit in, right? And wanting to socialize, and then also not being good at it, right? And that is something I think that, it happens among boys, but I think as girls, right, we are socialized to have a group of girlfriends, and on top of it you have the kind of mean girl exclusion, cattiness that goes on. And then being autistic, you can be so ill-equipped to deal with that, right? That is a landmine of social issues among the way that girls are socialized with one another. And so it's a little bit different, right? Because you have kids that really, really want friends, right?
Yeah.
And really, really want to be accepted by their peers, and yet are not because of, ableism, right? Or because they are struggling to find a way to connect with kids that are different than them. It's something my daughter experiences a lot. She wants to play, but she doesn't know how to ask. And, we really have been working on that. So I guess going into it, not assuming that it's I don't want to socialize, right? In fact, it can be really painful and involve a lot of shame and jealousy. It can be really awful to want to and not be able to. Right. And so when we treat it as a won't, right? Robin won't socialize at lunch. it's Robin's fault. Robin needs lunch bunch or whatever it is, right?
Yeah, that's the whole, I know. I mean, I guess
Right?
that's what I struggle with as a provider is like, sometimes I work with autistic individuals and they seem completely like, I actually hate lunch bunch, but that's a whole thing. But I have met some people who are autistic and they don't need social skill instruction. Like they actually do want to sit by themselves at lunch. And these are conversations I've had with former students I've worked with, where it is harder when it is a student who does want to socialize, but you're not sure how. And two, I think it goes to the fact that like where I work, it's a very small district, right?
Yeah.
So there's not a lot of, if I have an autistic girl, there may not be any other that are diagnosed, you know what I mean? To facilitate a friendship or, it can be hard based on your school setting, your school environment too. I think sometimes I think if I worked in a bigger district, it would be easier for some kids. And some kids I say, you know what, we're in a very small area here. You know what I mean? Like, I feel like sometimes when kids get into college, right, if you're into something that's really specific and nobody at your school is into that, I mean, now with the internet, right, that's nice because I'm sure you're connecting with a lot of people that have your same interests. It's like, you're going to meet other people that like these things too. This is just a very small part of your life. But I think that can be hard. Yeah. If somebody wants to have friends or wants to socialize, but isn't sure how to.
Yeah. And sometimes like the intervention needs to happen like across the school. Like it's not just like we always treat, the kind of medical model where like the autistic person is the problem and everyone else is like fine.
Right.
But, some of the more successful kind of things that have happened when in my teaching career have been when we've taken like a whole school approach where we're talking not only, to the students with disabilities, but we're talking to the students who don't have disabilities as well, right? And we're teaching them how to interact with people that are different than them, right? Like that double empathy problem where it's not that we, one group is, doesn't have the skills and one does or something. It's that we have different skills. We communicate differently. We want to play differently. And helping to kind of communicate across that barrier from both sides actually has the best results, right? So having everybody learn social skills, right?
Right.
Instead of, just deciding this particular student is, we don't know what to do with them at lunch. So here you go, lunch bunch.
Right.
Because what makes you more popular in school than eating lunch with the counselor?
I've been in very uncomfortable situations where I've inherited an IEP. That was some of my TikTok content that people liked was IEPs. But where I inherited an IEP goal that was lunch bunch, where a autistic student would need to ask a peer. And it was just like, I was anxiety ridden, right? Because what if the peer says no? And there were times where a peer would say, no, I don't want to, especially as kids get older, but that was a whole thing. Now, when kids are in middle school, if they come to me and they have a social need, or they do have some trouble navigating what I say, the social environment, because honestly, as just a completely typical female, social skills are very nuanced. Once a kid hits any age, school age, they just continue to get nuanced. Even as a 42-year-old female living in a suburb, I can tell you social skills are extremely nuanced. And the thing with social skills is that it's always different rules based on the environment, based on the people. So I feel like I try to tell my kids if they do work on social skills that I'm kind of just their social coach, and that it's even nuanced for somebody my age who doesn't have an autism diagnosis. But that's what's hard is that the players are always changing. The rules are always changing.
So on top of like, I guess the kind of to like bring it back to the question, the thing I would keep in mind is that we know we're struggling, right? Like, and on top of it, right, we also need counseling for like, it's like a two-part process where it's not just that we're struggling to fit in. It's that is now a feedback loop that is making us have low self-worth or to feel bad about ourselves, right? And that is like a, really hard balance, right? And that once you have an autism diagnosis, like your mental health like doesn't exist, right? It's just your behavior at this point. So thinking about the way that being different, especially in the social environment of girls in school, is tough. And it is, even if you're not diagnosed, right? So like I wasn't diagnosed and still had the same experience. It actually, the advice I would give to practitioners is really to make sure that you are not just reiterating the message of you're not good enough, right? Because we're getting that all day from our peers, from everybody. And then to have our people that are there to help us then kind of, hammer down the point that you are not good enough. It's you that's the problem. It can be really hard on your self-esteem. And it's really hard. The world tears our kids down so much, right? That we want to be building them up because kids are going to tear them down. And we want our therapy, if we want it to be truly therapeutic, right? It can't be just another iteration of that same message.
Yeah, I like that. That's good to point out. I like that idea of the counseling component too, because I don't think that's something that we talk about enough. That makes so much sense, how that can be like such a loop in your brain and all day. And I see that because I work middle school, high school. So I definitely see all those things.
So you do it all day and your peers are like, you suck. And then after school, you go to therapy and it's like, here's a list of all the things you can't do.
Right.
And then you go home and it's like, here's your checklist that you have to, now, then you can earn your iPad if you like whatever. Right. And all day long, it's you're not good enough. You're not good enough. You're not good enough. We would like you more if you were X. We would like you more if you were X. Right. And how much for a little girl to take on, right? It's a lot.
Yeah. No, those are good thoughts. So do you have any guidance to share with parents who may think that, their daughter's autistic? So like, what would be first steps kind of, if you're like, oh, I don't know, I saw this and I'm nervous, some parents just want to make sure they get their child the right amount of support if they need it. So do you have any guidance for parents that might think like, what, maybe my daughter is autistic? I'm not sure.
So getting a fair evaluation, like a good evaluation as a girl is difficult, and you have to do a little bit of legwork ahead of time. So not every doctor is going to have up-to-date information about autism in girls, particularly if your girl is more verbal, right, or is academically on grade level. It's even tougher, right, because people have these stereotypes in their mind, and professionals do as well. So what I would recommend is, one, start writing down just instances of things that you see, right? So like almost like that little, data collection or whatever, right? Of what scripts they're playing, how often they're playing it, can they deviate from it? What are the things they're talking about? How often are they talking about it, right? That repetitive behavior that's occurring over time, start documenting a little bit. So that when you go to the doctor, you can say, listen, like, I know it looks like this is like a really great pretend play session, but she's played this exact thing 47 times this week. Right. So having that information is really helpful. The other advice I give to parents a lot is go into whatever local group you have, and like, don't hang out in them because they're usually kind of a dumpster fire.
Yes.
But go into them for as long as you need to find out whatever the doctor is in your area that diagnoses kids like yours. Right. So I went in and I was, said, my daughter has X profile, right? And we're looking for an evaluation. If your child is like mine, who did you use? And so somebody gave me the name of a doctor. And we got a really great evaluation. And she is someone who now I refer people to who have more like sensitive cases, right? Because she has a very keen like diagnostic eye and will pick up on subtleties and will diagnose girls who are not intellectually disabled, right? And many autistic people aren't. Right. So that's the advice. If you can't find it in a local group, my other hack is to go on COPA, the Council of Parent Attorneys and Advocates, I think. Okay. They have a directory of advocates. It's actually like people who have to do some sort of level of certification to do advocacy work. Okay. And so it's a little bit more, advocacy is completely unregulated, but COPA gives you a little bit of a head start. So find an advocate in your area, whoever's like a good one, just pay their initial like consult fee, just go once, because they see reports from everybody in the state. If anyone has a handle on who's doing what, right, and who does what well, an advocate that works a lot does, right? They know who writes a good report. They know, they have a client that's probably just like your kid, and they know what doctor they went to. And so you can get a lot of information that way. And that's true of like finding any kind of practitioner, like even if you don't need an advocate to like go to court with the school district,
Yeah.
having a relationship with an advocate where you can just book like their one appointment and just go pick their brain for an hour. You can find a lot of information that way because they see what everybody's doing.
Right. Oh, yes. Yes.
So-
No, I work with many advocates in my district. I work in a very affluent district, and we work really collaboratively together. But I think it's a great idea. I didn't know that was a website. But I deal with advocates a lot just professionally and being speech therapist. So, okay, that's good to know. That's good info. Yeah, it makes a lot of sense because it would, somebody who's going to be nuanced, who has, the profile similar to your child. I like that idea because some parents may think I think that's the thing too. Every speech therapist is going to be different. Every, PhD is going to have a different level of knowledge base. So going to somebody that's going to be able to help you with your particular case, that makes a lot of sense. And
some doctors, like I will refer people who have kids with more significant needs to a different doctor because I know they're really good at that particular kind of profile.
Yeah.
And like, as much as you would like everyone to be good at everything, that's just not the case, right? So finding the doctor, whoever it is that diagnoses girls in your area, right?
Mm-hmm.
That's the best shake you're going to get at getting a fair assessment. Also take video if you can. Normally I don't like advocate videotaping like meltdowns and stuff. Yeah. But when my daughter was going through it, we had to because she would sit there with her hands folded the whole thing, talking to them like a 27-year-old,
right.
Charming, adorable, whatever, and no behaviors at all because she loves one-on-one adult attention. So of course,
right.
So I would videotape like certain things or whatever, just so I could say like, okay, like this is, how it looks right now, but you didn't see the 2 hours it took me to put a coat on her today.
Right.
So, and taking like a little video just to be like, here, delete them. Don't post them on the internet, please.
Yeah.
But that is another thing that you can do, especially if you have a kid that like will mask in the assessment.
Yeah. Yeah. No, that's a good thought for people. Such great information today, Robin. Oh my goodness. So delightful to meet you. So where can people find out more about you and your work?
So you can find me on TikTok as AuTEACH. On Instagram, it's AuTEACH Official. We have a YouTube channel. And then also I have a website and I have a couple of courses. And I think by the time this comes out, we will be just about 2 weeks away from closing enrollment for our next cohort of our parenting course. So I have a parenting course. It's a 6-week course. We go over potty training, feeding, executive functioning, behavior, all different kinds of stuff. We do a different topic every week. And then we meet live for a Q&A, one night a week. And then you get a ton of information as well. So hopefully people, maybe have an interest in that. And we also have like an online community you can join. So the website is where all of that is listed.
Awesome. Okay, great. Well, thanks so much for coming on, and I'm sure that I'll see you soon.
Yeah, see you. Catch you on the talk.
Yeah. Bye. Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.